So I'm excited because every Wednesday we are doing a 6-part series. This is part 4 of our 6-part series, and which products do I use for my customers. So I'm Dr. Rita McGuire. You can call me Dr. Rita. Make it real simple. I'm the Chief Medical Officer, one of the co-founders here at Wakanna, and I'm excited to bring this series because I get a lot of emails, and I love getting emails. Continue to send the emails. I get a lot of emails with questions about which product should I use. So this has been really, really a great platform. I've got a lot of positive feedback on the information that you'll be getting. So tonight we'll talk about CBD, or cannabidiol, what it is, how to use it, and why you should use it. A disclaimer that these statements made regarding the products we're going to talk about tonight have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research, and these products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information from your healthcare practitioners. Please, please consult with your healthcare professional about potential drug-drug interactions or any other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires that we read this notice. So a little bit about myself. I'm an obstetrician gynecologist, and yes, we have a 16-year-old mom upstairs. 16, first baby. So yes, I've been delivering babies for 30 years. I attended Wayne State School of Medicine in Detroit, Michigan. I completed my residency at Cook County Hospital right here in Chicago. I'm also CEO of RJM Wellness and Rita Fitness. I'm a global women's health and wellness speaker, as well as I'm one of the certifying physicians for the medical marijuana program here in Illinois. I'm also a member for Doctors for Cannabis Regulation. And as I stated previously, I'm one of the co-founders and the chief medical officer of Wakanna for Life. My recent new endeavor is I am one of the owners of Travis Garza Fat Loss Camp in South Florida, in Fort Lauderdale area. I'm also in school getting my MBA. So I'll be graduating in May, and then I'll graduate in November as a trichology instructor. So exciting how I'm just putting all of this together, my 30 years in medicine, my experience in the cannabis industry, along with these other endeavors. So I am a mom of 3 adult children. Thank God they are almost off my payroll. That little girl is still on my payroll. She's not a little girl, she's a young lady, but I have a 30-year-old Jacob, a 25-year-old Joshua, and a 23-year-old Hannah. Only one is going into medicine. That's the baby girl. These other 2 are in business. So yes, I'm still a practicing physician. In fact, I'm on call tonight. Like I said, we have a 16-year-old mom. We're inducing her labor because of elevated blood pressure. By the way, we'll be talking about hypertension tonight. I still perform surgeries, hysterectomies, C-sections, liposuctions as well. And then I had the opportunity to testify for the Judiciary Committee here in the state of Illinois when we legalized adult use cannabis. So my children after that just think I'm the coolest mom ever, that I testified for the legalization of cannabis. I want you to quickly meet my 3 other amazing business partners. Our CEO, Melissa Boston, is a visionary behind Wakanna. Our CSO, our Chief Sales Officer, is Phyllis Nash. We affectionately call her our midwife. And then Dr. Patricia Van Pelt is our CFO, and then myself, Dr. Rita McGuire, the CMO, the Chief Medical Officer. So let's get right into our topic. Let's first talk about cannabis. I think there may be a lot of guests on the line. I'm looking at the numbers, and I'm guessing that there are a lot of guests that really don't know that there is a side of the cannabis plant that doesn't get you high. And 4 years ago, I didn't know that. When I heard the word cannabis, light bulb went out, and that was marijuana, right? But tonight, it's important that you understand that the cannabis family has two different species, right? One species is called marijuana. That's the species that gives you the high. And it does that because it has high levels of delta-9 THC. On the other hand, hemp is another species that the cannabis plant produces, but because it has very low levels of delta-9 THC, by definition 0.3% or less, it doesn't give you the high or the euphoria like marijuana. So both species have CBD or cannabidiol, which we're going to be talking about tonight, and delta-9 THC, but it's the hemp that gives you the health without the high because it has very low levels of delta-9. So what is CBD? Well, CBD is an abbreviation for cannabidiol. And maybe you can't see because the print is a little small, but you can just see by the pie shape that CBD has more medicinal benefits than any of the other parts of the plant. So CBD is an antibacterial, so it can help to treat bacterial infections. It also can inhibit cancer from metastasizing, from growing into other organs. It's neuroprotective, so it helps to protect nerves that have been damaged. It promotes bone growth. It also reduces seizures. In fact, CBD and cannabis as a whole really became mainstream when we learned about Charlotte Webb, right? A little girl that was having 300 seizures a week. And when her parents introduced her to the cannabis plant, she went from having 300 seizures to 3. It also reduces blood sugar levels. We're going to be talking about diabetes tonight. It helps to reduce inflammation. It helps to improve the immune function. Because what happens in autoimmune conditions, I don't know if you know someone who has lupus or fibromyalgia or rheumatoid arthritis or multiple sclerosis. Those are some of the autoimmune conditions. It actually helps to improve the immune function in those people. It also helps to reduce arterial blockage. So we're going to talk about cholesterol and high cholesterol. That can lead to blockage of blood vessels in the heart, which can lead to stroke and heart attacks. It reduces the contractions of the intestinal tract. So people who have stomach issues or ulcers or Crohn's disease really benefit. It reduces nausea and vomiting. So if you have someone who is getting chemotherapy, or maybe it's even a pregnant mom that's having that first trimester nausea and vomiting, it can aid to help reduce those symptoms. It relieves pain. That's the number one reason why people tend to use CBD, because it relieves pain. And then that's number one reason they choose CBD for pain. But number two is to reduce anxiety, to reduce stress, reduce depression. It helps to also suppress muscle spasms. And again, we talk about multiple sclerosis. Those patients and people have frequent muscle spasm. It helps to relieve those spasms. It's very soothing. It's very calming. It's very tranquilizing. And then CBD also addresses skin disorders like psoriasis and eczema and acne. And then last but not least, because we're going to touch on hypertension tonight, CBD can vasorelax or dilate the vessels so that blood can flow freely blood can get to those important organs like the brain and the kidney and the liver. So it's a vasorelaxant. We see the other compounds that the plant makes. In fact, the plant makes over 118, 120 compounds, but these are the other main compounds like CBG and CBC and delta 9 and delta 8 THC that really work together. There's a synergy when they come together as a full spectrum product to really help to reduce symptoms that folks are having. So when we look at how CBD works, how does it work in the body? That was my very first question, right? When I was introduced 4.5 years ago to CBD. And it works in the body through a regulatory system, a very vital regulatory system called the endocannabinoid system. And what's so fascinating about the endocannabinoid system is that we all have one. And in many of us, this system is deficient in compounds that the plant, the cannabis plant, can give us. So when we consume CBD, we're feeding these receptors that are deficient. And when they're deficient and our body is deficient, it causes an illness, or it can cause inflammation, or it can cause stress and anxiety, or it can cause so much inflammation that our blood vessels are inflamed. It can cause hypertension, or it can cause so much inflammation in the pancreas that we have issues with high blood glucose levels. So the endocannabinoid system is how CBD works. When we consume it, it binds to receptors and it just sends a signal out to put the body back into balance. So there's different methods of consuming CBD, right? Many of you probably have seen CBD at the gas station, at smoke shops, at video stores, etc. But we'll learn why it's very important to use a high quality CBD product like we offer here at Wakanna. So the different forms that you can consume CBD is in the form of a vape cartridge, or you can swallow a capsule, a pill. It can come in a tincture or an oil that you put underneath your tongue, or it can come in a topical where you just rub it on a sore area of a joint or a muscle. Or what I really love are edibles. So you can eat CBD. You can eat it in the form of a gummy. You can eat it by using CBD in your favorite recipe. So these are the different methods of consuming CBD. So we're going to incorporate some information with our products. Our products are here. We are the crown jewel of CBD. But what's very important that you understand is that our products are tested. Our products are tested in one of the top ISO certified labs in South Florida. So because I'm in South Florida a lot now, I'm able to meet with the staff. I'm able to meet with the chief scientific officer, Dr. Marsh. I'm able to really see our products going through the system and getting third-party validation. And that's key. That's key during this time because the FDA does not require CBD products to be tested, but our products are tested. So when we do our testing, we are able to provide to our customers, to our distributors, certificates of analysis. Certificates of analysis will allow you as the consumer to see the potency, to ensure the quality, to ensure the product is free from pesticides, from residual solvents, from microbial, bacterial harmful microbial products, mycotoxins and heavy metals, as well as allowing you to see terpenes. And terpenes are really a very important part when we talk about our full spectrum products because terpenes also have medicinal benefits as well. So the certificates of analysis are found on every single product that we offer here at Wakanna. Our full panel analysis are seen on any products that you ingest. And then the other products like our topicals also will show the potency and quality of the product. So let's talk about our tinctures first. Tinctures are placed underneath the tongue. We have two lines of tinctures. We have a power, which is the black label. That's our full spectrum, which contain the legal limit of THC. Whenever you see a black label, that means the THC content in that product is 0.3% or less, along with the other cannabinoids like CBD and CBG and CBC. Then we have a pure line. The pure line is the line that is considered the broad spectrum. Broad spectrum means that it contains less than 0.0% of THC. So our broad spectrum products, our pure products, are very safe for those who have random drug screens at their jobs. So how do you use the oil? It's important that you place it underneath your tongue and you let the oil or the tincture sit there under the tongue for at least a minute. If you want to increase the absorption of the oil, you hold it under the tongue before you swallow for 2 to 3 minutes. But again, the effect of the CBD in a tincture form usually takes about 30 minutes. Sometimes it can take up to 2 hours before you feel an effect. We always want you to start at the lowest dose initially, because if you introduce too much CBD too quickly into the bloodstream, it can cause some minor side effects like extreme fatigue, nausea, and headache. So start low, start slow. The recommended dosing on our tinctures are 3 drops twice a day, 3 drops in the morning, 3 drops in the evening. Now, some things that you can do to improve the absorption is that you can take your CBD with food, right? You can also hold the oil underneath your tongue longer than a minute. That will also help to improve the absorption of the oil. So let's move on to our smokables. Smokables are another form and way that you can consume CBD. It comes in vape cartridges, our hypnotic raspberry jane. We have some Delta 8 cartridges, or you can use a CBD joint. It is a CBD pre-roll that is already ready for you to use. There's also our premium flower where you can roll your own CBD joint. Now remember, when you hear the word joint, you won't get high. It's the health without the high, because the CBD is coming from hemp. So what I love about vape cartridges and pre-rolls is that they act very quickly. Within 5 to 15 minutes, you're feeling the effect of the CBD in your body. It's important to have one single inhale and wait a couple of minutes before you do another inhalation, right? More is not better, even when we talk about vaping. The best way to vape is to take a deep breath in, hold the vape for 3 seconds, then hold it in the back of your mouth for another 3 seconds, and then exhale. So if you're a smoker, it's real easy, but if you're a novice to vaping, it's easy as well, just holding for 3 seconds twice before you exhale. Our edibles are amazing, as all of our products are, but our edibles come in different forms. One form is in the form of gummies. Another form is in the form of our coffee. And then a third form is in the form of our culinary oil. So you can actually bake and cook with your favorite recipe by using our culinary CBD oil. Now, when you're using edibles in the gummy or coffee, or particularly the gummy and coffee, you have to understand that when you consume edibles, it takes about 90 minutes to get into your bloodstream. It's got to be delivered through the stomach to the liver and then the bloodstream. So start low, start slow with either a fourth of a gummy, a half a gummy, or a whole gummy. You want to wait before you start to eat more of a gummy, at least an hour, because you don't want, again, to get too much CBD in your system. With gummies, it's a great thing to take at night, 30 minutes before bedtime. It can also, these gummies can be used to assist in different areas, but a lot of people like using the gummies to assist with their insomnia. Now, topicals also are a very, very favorite part of mine because I work out so much and so I'm always sore. So topicals offer local relief. So you can use the topicals in areas that have discomfort. We have an extreme power relief cream, which is a great salve cream that I like using at night so I can really rub it in and have a restful sleep. Or we have Dr. Rita's Rub. That's a liquid form. It's in a roller ball. I like carrying that baby around with me in my purse or my lab coat so that when I need it, I can just take it out and roll it on that sore area. We have other topicals like our body cream, great for what we talked about, how CBD can assist with eczema and psoriasis and acne. We have a Holy Glow. It is an CBD facial serum. I use it on my face. It helps to reduce those wrinkles, so it's anti-aging. It also assists with those who have issues with their skin, like acne, psoriasis, and eczema. So these are our topicals. We have some products we're going to talk about when we talk about menopause. We have some sensual body creams that really help as aphrodisiacs. Our oud body oil is amazing. It doesn't contain CBD, but that oud body oil actually helps to soften the skin. So again, how do you use topicals? You just apply it topically to any affected area because millions and millions of people have chronic pain. At some time or point in your life, you're using BioFreeze, or maybe you're using an ice pack, or maybe you're even taking Tylenol or Advil or Motrin for your pain. Well, now you have an option and a solution to use CBD. Now, when you use topicals, it typically works pretty quickly, within 5 to 10 minutes. Not all CBD topicals are made equally. In fact, we have a proprietary formula on our topicals where we've enhanced our CBD with essential oils like peppermint and spearmint, a lot of essential oils that reduce inflammation. We have included them in our products. And then CBD comes in a capsule. Yes, there are a lot of people that just don't like the taste of the tincture or the oil underneath their tongue. So now you can offer them our Power King to Chaga. What we've done is we formulated an amazing product that uses the chaga mushroom and CBD. Because it's a capsule, because it's more like an edible, right? It's going to take about 90 minutes to get into the bloodstream. So you want to take one capsule twice a day. And again, it is a great option for those who don't like the taste of tinctures. So what are some of the key benefits of chaga? Chaga is a mushroom, right? This is a mushroom. It typically grows on a birch tree. It looks like a piece of dirt, right? But it actually is a mushroom. But it's full of great nutrients and minerals and vitamins like B complex, vitamin D, potassium, fiber, zinc, iron, magnesium, calcium, and selenium. I'm telling you, the studies and the data that have been done on this chaga mushroom will blow your mind. It's a nutrient-dense superfood. It helps to lower blood pressure. It helps to slow the aging process. It prevents and fights cancer. It supports our immune system. It also reduces inflammation. It lowers blood sugar. And I want to point out that it's very effective in lowering blood sugar. So if you're on insulin, if you're on metformin, if you're on medication already for your blood sugar, you want to let your physician know that you're going to be using this product, and you probably want to test your blood sugar a little bit more frequently. It helps to also prevent drug side effects. So other medications that we put our patients on that have side effects, it helps to reduce those side effects. And this chaga mushroom is also very effective in reducing cholesterol. So I've included a study. It was a very, very powerful study. And it's a study where they used the chaga mushroom in mice that had cancer, and how it reduced the metastasis of cancer. So chaga mushroom is a superfood. It's a great addition to our product line, and we've enhanced it with CBD. And then we have sexual health products that help with sexual health, vaginal dryness, libido. Like I said, these body butters, lotus and hibiscus, act as aphrodisiacs, getting you in the mood. We have a whole hair care system, save our strands. We know that a lot of folks that had COVID lost their hair. It's called COVID hair, and we can help restore that hair. We have shampoo, detangler, styling cream, all infused with CBD to help that follicle to grow. And then we offer essential oils. I want to point out one of my favorite essential oils is black seed. You know, black seed has been shown in studies to also help to rebuild the beta cells of the pancreas, rebuild those cells to help reduce high sugar levels. I also love our First Defense. Our First Defense is a nasal spray. It has CBD and essential oils because we know that the viral particles enter through nasal passages as well. So great lineup of essential oils. So let's talk about some conditions tonight, and we're going to talk about some of my recommendations because this is a series about what products should my customers use. So let's say you're dealing with a woman that is menopausal, right? Menopausal women have a lot of issues. Most menopausal women don't have periods, but some may have irregular periods before they really go full blown in menopause. They have decreased libido, right? They have a very low sex drive, and that happens because of the fluctuation and the rapid drop of estrogen. They have emotional changes. They're typically very moody, very irritable, very mean, right? They have hot flashes. They have night sweats. They have vaginal dryness. And because they're so miserable, they can't sleep. So let's look at some of the products that I would recommend for a menopausal woman. Well, we want to keep the body in balance. We want to keep that body in homeostasis. CBD has receptors in the reproductive tract, in the uterus, in the ovaries, even in reproductive tract in men, in the testicles. So I would recommend that we get the body in balance. So those tinctures that we talked about earlier, the power, the full spectrum, or the pure would be a great addition to someone who's looking to relieve their menopausal symptoms in a holistic, organic way. Start low, start slow. 3 drops in the morning, 3 drops in the evening. Also, our hibiscus and our lotus, our body oils and creams are also something that can help address the libido along with our CBD lube. Libido, vaginal dryness, these sensual scents actually help to be aphrodisiacs and help women to get in the mood. And then for the night sweats, for the mood swings, for the insomnia, can be addressed with the gummy, right? The gummy at night, a half to a whole gummy at night, will allow the body to get that restorative sleep, that REM sleep, that sleep that when they wake up, they feel energetic and not fatigued. So that's my recommendation for menopause. Remember, this is not a menopausal package. These are separate products that you can recommend for your customer. Hypertension. Hypertension is another question that I get. You know, what do you recommend for those who have high blood pressure? Some common symptoms of high blood pressure is dizziness, breathlessness, persistent headaches, chest pain, and fatigue. Obviously, if you're having chest pain or breathlessness, you need to call 911, right? We understand that the seriousness of allowing your blood pressure to go unchecked can lead to heart attack and stroke. So these are some of the products that can assist with those symptoms that many who have high blood pressure have, and even help reduce the blood pressure. Why is the blood pressure high? Well, there's a lot of inflammation in the blood vessels. That inflammation causes blood flow to be compromised, which then increases the number, 140, 180, over 100, right? So these are my recommendations. Either you recommend the tincture, 3 drops twice a day under the tongue, or you recommend the capsule. The capsule, we talked about the chaga mushroom. We talked about the benefits in it improving blood pressure, blood sugar, cholesterol. We talked about the fact that many times there's some people who don't like the taste of the tincture. So what better option to recommend but our CBD capsule that has combined the chaga mushroom in a capsule form. Now, 1 capsule twice a day is all you need. I also put in the far right corner on the top at night to recommend a power gummy so that person can sleep. Again, when you sleep, your immune system resets itself. Your body resets itself and heals. Energy, a lot of people who have hypertension have fatigue. A lot of times the fatigue is from the medications they're on, the side effect from the lisinopril, the amlodipine, and all of the other medications that you may be on. So peppermint. Peppermint gives you that natural energy. You could recommend that they spray peppermint on the soles of their feet, or they can spray it right in the palms of their hands and just inhale and get that natural energy. So that's my recommendation to start with someone who has hypertension, the tincture or the Power King to Chaga. Now, when we move on to diabetes, diabetes is another question that I get a lot. Diabetes signs and symptoms may include feeling tired and sleepy, very much like those hypertensive or high blood pressure patients, confusion or passing out, stomach pain or feeling sick, needing to urinate more often because of the high ketones, blurred vision, being very thirsty, and high blood sugar levels. These are some of the signs and symptoms. And again, we can never say that our products will cure your diabetes, right? We're not here as physicians to make any diagnosis. We are just here to offer a tool, just a tool, another tool in their toolbox. So here are my recommendations for diabetes. I want to say that if someone is diabetic and they have urine drug screens at their job, of course, you always want to recommend the pure or broad spectrum tincture. If they're not undergoing urine drug screens, then the full spectrum tincture. And I always add black seed oil. Now, many of you who are business owners and have gone through certification, you know that our Power Hempranium 500 milligrams has black seed, turmeric, and peppermint. So why, Dr. Rita, would you recommend a bottle of black seed? The additional bottle of black seed will also help to reduce the inflammation, specifically in the beta cells of the pancreas in diabetics. So that's why I always recommend in diabetics that you have them purchase black seed oil along in addition with their tincture. Now, maybe someone doesn't like the taste of the tincture. So you can recommend the Power King to Chaga, because we talked about how this mushroom combined with the benefits of CBD help to improve blood sugar levels. Again, if you are on insulin, if you're on metformin, if you're on any blood sugar lowering medication, taking the Power King to Chaga could lower your sugar really, really low and fast. So you want to make sure that you are checking your sugar. You want to make sure that your physician understands that you're on this product. You take one pill twice a day. Always, always loop your physician in when you are using any organic, holistic, natural option for your health. Now, on the side, I put our Power Extreme Pain Cream. Why? Because most diabetics have neuropathy. Most diabetics have nerve pain. They have numbness and tingling in their feet and in their fingers. So you want to use that Power Extreme Pain Cream and offer them to rub that on their feet, on their fingers, anywhere where they have that nerve pain. And again, diabetics are often fatigued as well, so you can offer them the peppermint spray. And again, I didn't put it in the slide, gummy at night to help them sleep. So that's my recommendation for diabetics. They can either do the tincture and black seed or the Power King to Chaga. With the Power King to Chaga, you don't need to add the additional bottle of black seed because the power of the mushroom in reducing blood glucose or blood sugar is very, very effective. Last but not least for tonight is thyroid disease, right? I get a lot of questions about thyroid disease. It can be hypothyroidism or hyperthyroidism, but just know the signs and symptoms of hypothyroidism is just like hypertension and diabetes, right? Fatigue. There can be weight gain. There can be dry skin, hair loss, and constipation. So what are my recommendations for someone who has thyroid disease? Well, many, many people with thyroid disease do suffer from hair loss. That's one of the top reasons that we see alopecia or hair loss in those folks. So the Empowered Hair, I would absolutely recommend. That's a product that can be used topically or it can be ingested as a tincture for hair thinning or hair loss due to a thyroid condition. The fatigue, you want to address that with the peppermint spray. It's a great way of using a natural energy. And then there is the dry skin. So our oud oil or our hibiscus or lotus is good. Now, when you combine the shampoo or Save Our Strands is a whole system that always should be combined whenever you're addressing hair loss or hair thinning. So whenever you're recommending Empowered Hair, that hair system should go right along with it. The shampoo, conditioner, etc. Now, many, many people suffer from weight gain and hypothyroidism, right? A lot of my friends, when we were younger, we used to joke about it. We used to say we must have a thyroid issue because it was so hard for us to lose weight. But you can offer our flat belly products if they are looking to, one, improve their thyroid condition, reduce the inflammation in the gland. They can do it by using the flat belly gummies, one gummy before each meal. and the flat belly brew, 1 scoop in the coffee. Now, the bitter is a tea that you should detox. You should always detox at least quarterly to get the toxins out of the liver and out of the colon. So with thyroid disease, and specifically hypothyroid and even hyperthyroidism, you notice that I didn't include a tincture, so to speak, right? And the reason being is that, one, the hemp-powered hair, if used internally, is already your tincture that you're getting CBD in your system. And two, many of these patients are overweight. So they're getting CBD in the flat belly gummy. They're also getting it in the coffee. So last night we talked about taking too much CBD. You don't want to take too much CBD. You want to concentrate on those issues that are really causing a challenge in that person's life. So by using these products, you can get enough of CBD and address energy and hair loss as well. Very good. Oh, I have one more, I'm sorry. And that is smokers. I didn't realize that people still smoke cigarettes. And the reason I know a lot of people smoke cigarettes is if I go out that door and go through the emergency room of my hospital and go outside, I will find at least 3 to 4 nurses or ancillary staff smoking cigarettes. So yes, you can help those who smoke cigarettes with our products. Now, smoking is an addiction. You see smokers that are chain smokers or smokers that are triggered by food or alcohol that may be a trigger for them to smoke. Most people smoke a cigarette, right, after they eat. So this is an article that was fascinating to me, again, showing how they took a group of patients that were non-smokers or smokers, and they gave them CBD, and the other group that was smokers, they gave them a placebo. And the group that received the CBD in 3 days stopped smoking. 3 days. So some of the signs and symptoms of nicotine withdrawal, because the nicotine withdrawal is really what makes people relapse. It's the withdrawal that makes people smoke again. So you want to address the withdrawal symptoms and the cravings, and CBD does that. So some of the signs and symptoms is overeating, right? Cravings, depression, anxiety, and sleep problems. So you want to address that with these particular products. Fatigue, give them that peppermint. For the cravings, you want to recommend either the CBD vape cartridge, the Delta 8, or the pre-roll or the premium flower. This way, each time they have the craving or the urge to smoke a cigarette, you offer them the vape cartridge or the pre-roll. You instruct them, instead of smoking a cigarette, take 1 to 3 pulls on your vape cartridge or your pre-roll. That is going to go into the brain, the pathway that causes the nicotine craving, and it's going to block those cravings. And then in turn, it's also going to address the withdrawal symptoms, right? The irritability, now they've got to do something with their hands, right? And what do? They usually eat. So it's going to address all those withdrawal symptoms. You want to offer them the tincture. The tincture is going to allow a steady state of CBD in their bloodstream so that the cravings and withdrawal symptoms are addressed. So 3 drops in the morning, 3 drops in the evening, and then for sleep, the power gummy. So this is my recommendation. I've used it before in patients who were smokers, and it works. It effectively helps those who are smoking cigarettes still with that addiction. So peppermint spray, any of the smokables, the pre-roll or the cartridge, the Hempranium 500 tincture, and the gummy to help them sleep. So I promise you that's it. Tonight we covered hypertension, we covered menopause, we covered diabetes, and we covered smokers. If you listen to my other recordings, if you listen to part 1, part 2, and 3, you will get all of the other challenges we talked about. We talked about gout. We talked about fibromyalgia. We talked about congenital heart disease. We talked about overall wellness. What would you recommend for someone who's not on any medications, who's perfectly healthy? That overall vitamin, we call that vitamin CBD, keeps the body in balance so that it prevents any long-term challenges from happening. So I'm going to stop sharing. That's all for me tonight. If you have some questions, you can put your questions right there in the chat. I'm going to look and see if there's any questions. Let's see. My brother smokes, has random drug tests. So if your brother has random drug testing, you're going to have to use the pure tincture, the broad spectrum tincture, and the pure gummies. That will help as well. He won't be able to do this motion with a CBD product, but he absolutely can do this motion. He can take a gummy and pop it in his mouth each and every time that he has an urge to smoke. Let's see. Is the CBD liquid relief roller ball help with muscle spasms as well? Yes. So the CBD liquid relief can help to assist with those symptoms that many who have multiple sclerosis have, and that's muscle spasms. There's some people that have something called restless leg syndrome. You can simply take that roller ball and just roll it on the area of the spasm, or roll it on the area of the sore joint or muscle. I love the roller ball. It's just very convenient and very portable. That's why at night I use my cream. I like that cream to really get deep into the tissues and really help to relax the muscles at night and to allow me to sleep without waking up in pain. You can improve the absorbability or the bioavailability by using more cream if you need to. That's okay as well. Topical products do not pass the blood-brain barrier. So if you have random drug screens, you can use the topical product. The only way a topical product can come up in a urine drug screen is if you eat the topical product. So please don't eat the topical products because they're meant to apply topically.
Hey, Dr. Rita, can I add for the muscle spasms?
Uh-oh.
Primary condition.
Oh, I did. I had my volume down low. Could you guys hear me? No one said anything.
I could hear you.
Oh, good. Yes, please, Erica, chime in.
No, I was just going to add that I take the Hempranium FB every night.
Can you show your face?
Oh, Lord, sure. I'm tired.
Yay, show your face.
It's been a long day.
Oh, I know.
Wait a minute.
Believe me, I've had an extremely long day.
Yeah, no, I was just going to say that that's one of the things that I take every night because I'm trying to get through the night without having a muscle spasm. And with MS, I have a lot of muscle spasms. That's one of my primary conditions that I'm trying to have the CBD assist, that and spasticity, tightness in my muscles. So I use the Hemp MD, and I use the Power Hempranium, the Power Pain Cream every night as well. After I get out the shower, I just rub it all over. And sometimes I think this one day this week, I actually added the rollerball behind my knee joints. That was helpful to me too. I felt like I could get into places that I couldn't do just rubbing it in. So
thank you so much. Yeah, the products, and this is going to bring me to the next statement. And the question is, how quickly do these products work? One, for hypertension. And it really does depend on a lot of factors on how quickly products can work. It depends on your body chemistry. It depends on your diet. It depends on your weight. It depends on how high your blood pressure is. If you're a really brittle hypertensive, where it's really hard to get your blood pressure down, you're on multiple medications, then it may take a little longer. So we can't give you an answer because it depends on so many factors. And another thing is that we don't want it to work too quickly because then your blood pressure would bottom out. We want it to slowly get into your system. That's why I always say start low and slow. You never want to give someone a lot of CBD at the beginning too fast because it could bottom out someone's blood pressure, it could bottom out someone's blood sugar, and make someone feel really, really uncomfortable. Okay, I'm glad you heard me, but my volume wasn't all the way up, so I'm sorry about that. I'll take a couple of more questions. We have 7 more minutes. If there's any other questions. Let's see. I'll go up. Oh, great. So the Delta 8 products really help your blood pressure. It's good to hear that. Very, very good. Delta 8 is a new kid on the block. It's a cannabinoid that's very, very closely related to Delta 9. It's called Delta 8. So Delta 8 you have to use very sparingly. You don't need a lot of Delta 8. So with the gummies, we recommend that you use 1/4 of a gummy of Delta 8. And with the Delta 8 vape cartridges, you absolutely want to start with 1 pull and wait at least 15 to 20 minutes before you take another pull. So it's very potent and it works very, very well.
Dr. Rita, there's a question in the Q&A about high cholesterol and diabetes. I think you may have answered it, but it came from Cynthia. Oh, she's asking again. She's asking.
We're getting a lot of questions. I missed it. Okay. What would you take for high cholesterol and diabetes? So, I would overwhelmingly say the Power King to Chaga. That is our newest product. It combines the Chaga mushroom with CBD. It will address inflammation. It will address blood sugar lowering as well as blood cholesterol lowering and blood pressure. So it is a super dense nutrient. It's got a lot of great minerals and vitamins, but there's a lot of studies that have been done on this chaga mushroom that makes it very, very effective when we're talking about high cholesterol and high diabetes. That way you've got one product and you're addressing that with one product, one chaga capsule with CBD twice a day. That's my recommendation. Timely information. Yesterday, I had a male customer ask me about products for his wife going through menopause. Absolutely. Menopause is very, very, very difficult for us women. And so now you have that information that you can take back to that customer for his wife. So if you are a guest on the line, you want to connect with the person who invited you so that you can get these products, that you can get the old recordings too, because there's a lot of great information about other challenges that you may have that you didn't hear tonight as well. And we want you to join us next Wednesday. Next Wednesday will be part 5 of a 6-part series. I'm super excited to bring this information because this really brings clarity, because I get so many questions about which product should I recommend for not only our customers, but even ourselves. You know, when you think about all of the things that are going on with just COVID, and you top that off with other challenges that we all may face in our family and our friends and our coworkers, like chronic illnesses, hypertension, diabetes, high cholesterol, arthritis, stress, anxiety. When you look at the formulation of the Power King to Chaga, combining the mushroom with the CBD, it's really a powerful, powerful statement that you can really make in helping those with a lot of multiple things that are going on. And the reason why that's important is because last night we talked about a new distributor that had multiple conditions going on, and she literally was taking like 10 different products, which added to be close to 200 or more milligrams of CBD every day. And she had the complaint of extreme fatigue and lethargy, right? We don't want that. We want these products to make you feel energetic. We want these products to address your conditions, but we certainly don't want you feeling horrible. So we want to make sure that you are using the appropriate products where it makes sense, and you're not using too much of it as well. Erica, you want to say something else?
Yeah, I was going to say there are a couple more questions in the Q&A. One is about lupus. What should they use? And I saw one pop up for RSD. What should they use?
Okay. So what if you have a question about lupus, that's on the recording from last week. We can get that recording to you. And what was the other question?
I believe it said RSD. It flashed by, but I think
RSD. RSD. What is RSD again? Acronym for?
Let's see if they.
Is it a radiculopathy? RSD, the radiculopathy RSD, where they have very painful joints?
They didn't specify. They said what would be used for RSD. I don't know what it is.
So if you can put, if it's the radiculopathy, absolutely our topical pain you want to use, as well as the Hempranium 500. So whenever you're dealing with a condition that causes inflammation and pain and affecting joints, you cannot go wrong with a topical product, combining that with the tincture. And of course, you need to sleep at night, a gummy for night. Hopefully they'll answer, but if not, you can email me any additional questions that I might have missed. You can email me at Rita MD. I love emails. Just email me all night, all day long. RitaMD@Wakanna.com. But before you email me, make sure you connect with the person that invited you on this call so that you can get your products, and you can also get the recordings from prior weeks. Wonderful. So be well, be safe, and I'm going to go upstairs and deliver a 16-year-old baby. Well, I call her a baby, but a 16-year-old patient who's an emancipated minor now, so she's an adult. But be well. Thank you, Erica, as usual, for your contribution. Erica is part of our medical advisory board here at Wakanna, and I want to thank all of our business partners. Thank you, guests, for tuning in. We'll see you next Wednesday at 8 o'clock. Good night.